So, hi everyone. Good afternoon, everyone. I am Dr. Ambuj. I have done my DM cardiology from KM Hospital, Mumbai, and I am working as an assistant professor in cardiology over here. Very happy to have you all here. So, we will start the class. The first class being cardiology assessment and diagnostic techniques. So, cardiology, as you see, is a very beautiful branch. So, when you see heart, it keeps on working even when we are sleeping. So this is one of the few organs in our body which does not stop working. Even if you are doing your work, you are sleeping, or you're doing anything. So this is such a unique organ to have. And the beauty of cardiology is that the patient's response is very quick. So if any patients of heart attack is coming to you, he will be very anxious, he will be very sick. And once you do the angioplasty and angiography, the patient will behave like as if nothing has happened. So the results are very quick, the complications are very fast, you have to act very fast. So these are the things uh, which help me in taking cardiology as a branch and as a career. So very warm good afternoon to everyone. Now I'll start the presentations. So my topic of presentation today is cardiology assessment and diagnostic techniques. So as you see, you can see the image showing the anatomy and physiology of the heart. So this is the
Clinical cardiology begins where symptoms meet precision. History remains the first diagnostic tool: chest pain, dyspnea, palpitations. Clinical examination refines suspicion: JVP, murmurs, peripheral signs. ECG decodes rhythm, ischemia, and acute cardiac events within seconds. Echocardiography reveals structure, function, and valvular pathology in real time. Biomarkers like troponin confirm myocardial injury with high sensitivity. Stress testing unmasks hidden ischemia under physiological demand. Advanced imaging, CT angiography, maps coronary anatomy non-invasively. Coronary angiography remains the gold standard for definitive diagnosis. In cardiology, diagnosis is not a test, it's a synthesis.
left ventricle, this is right ventricle, this is interventricular septum, this is the conduction system of the ventricle. Go through the proper method of checking the blood pressure. Always check blood pressure in both the limbs and lower limbs. We have seen various numerous cases where the patients of coarctation of aorta are missed because BP was not checked on the lower limbs, and the patient eventually ended up into getting various investigation, angiography, heart failure treatment, everything for 20, 30 years, but nobody took blood pressure in the lower limbs. So this could be catastrophic for the patient and for the doctor also. So checking the blood pressure is the most important thing which you can do to your patient. Apart from blood pressure, you have to look for pulses. You can diagnose various disorder based on pulses. There are various uh, named pulses. We will look for the rhythm of the heart, any VPCs, any APCs, premature complexes, any runs of ventricular tachycardia, any runs of supraventricular tachycardia, any we look for sinus pauses, and we look for complete heart block. So if anything among those can occur, we can diagnose and treat accordingly. So Holter is one of the important.
Your ECG is normal, but the symptoms persist. So what are you missing? Enter Holter monitoring, continuous ambulatory ECG. Records cardiac rhythm over 24 to 48 hours. Captures real-life transient arrhythmias. Ideal for detecting AF, PVCs, pauses, and silent ischemia. Correlates symptoms with rhythm events. Improves diagnostic accuracy beyond snapshot ECG. Guides therapy, from reassurance to intervention. Holter monitoring, and because timing is everything in cardiology.